Thank you very much, everybody. Hope you've all had a little bit of a break. Drink. So we're going to spend a little bit of an intense hour really digging into the how-to. And when I was preparing this presentation, it's very much similar to when I do presentations on the HIV Clinician Society, as for example, brought out a guideline on advanced clinical care. We've got guidelines on pre-exposure prophylaxis. We've recently got a guideline that we've brought out on chemsex. So this is very much going to be on the same front. So when I do a training on medical gender affirming treatment, it's just like any other medication that we prescribe. There's very much on how do you initiate it, what dosing do you use, how regularly do you monitor it, and we're going to really unpack the ins and outs of that in this session. So I'm vaguely thinking that hopefully at some point you might be in a situation where you're either prescribing this treatment, or you're a nurse caring for somebody who is on this treatment, or you might be a pharmacist who's actually dispensing this treatment. So we're going to get very practical in this session. This is a bit of a medical session, so we're also going to talk a little bit in terms of the whole taking a sexual health history. And the reason why we've included this as a specific section is because it's so important with our transgender people to be a little bit sensitive around how we talk about sex and gender. And so we're going to just quickly cover some of the basics around that. And I think it's important to realize that when we talk about transgender and gender diverse people, they're actually an extremely diverse group within themselves. And the sexual and behavioral risk is very different among different TDD groups. So they're not like a group of people where you can make an assumption on how they have sex or what their kinds of risks are. There's certainly a vulnerability to STIs and HIV, but most of this vulnerability is actually due to the fact that transgender people are not accessing HIV testing, for example. They're not accessing the care that they're not going to clinics because they are feeling stigmatized, they are feeling not welcome, they're getting misgendered. And so the problem is that they don't get condoms, they're not on pre-exposure prophylaxis. And so also we're not actually adequately counting them either. So we're not always aware of who they are or where they are. Most of our tools are not looking for that. So when we talk about sexual health assessment, this is out of my presentation that I do with my medical students. The CDC has got something called the 5 Ps of a sexual health history. Where in sort of all the questions you go through for partners, practices, past history of STDs, protection from STDs, and pregnancy plans. I'm not going to go through every line of these, but I'm just going to highlight the areas that are important for our transgender population. We also have added a 6th P to the 5th Ps called pleasure. And that's about a sex-positive approach. We've got a bit of a habit in the world of sexual health history that it's all doom and gloom, right? It's all about all the terrible things that might go wrong. But of course, the reason we have sex, hopefully the only reason that we should be having sex, is for shared pleasure. And yes, you might occasionally in your life have sex to try and make a baby, but the majority of times in our lives when we are having sex, it should be about pleasure. And when we're having conversations about sex, we should actually put sexual pleasure, freedom, and diversity in the center of those conversations. It's also important to realize that when we talk about sexual health in South Africa, also with our very high gender-based violence prevalence in the country, is that quite often asking these questions and actually also trigger people, and there has to sort of be a trauma-orientated approach. So the simplest thing with your transgender patients is before you're going to ask them about sex, make sure you're using the correct name and pronouns when we address them. But if you're going to ask people about their sex life, you really have to ask permission. It's not cool to just launch in. And quite often I see sometimes with the medical students, we're so fixed on our they've got that little form of all the questions they're supposed to ask, that these sort of, in the same breadth where you ask about their past medical history. You also ask about what kind of sex they have. So you've got to go about sex. We have to be respectful. And I always clarify to my transgender patients that I ask all my patients these questions. So sometimes our queer community are very sensitive that we are prying for the sake of prying, and being able to reassure them this is part of my consultation that I always do, and it will be obviously talking in terms of privacy and confidentiality. So the first question, and this is from the CDC, is obviously always asking people, are they having sex of any kind? And it's good to be broad. Otherwise, people think just of penetrative sex. And then asking what kind of intercourse we have. The CDC tends to be quite vague when they ask these, broad when they ask these questions. I sometimes find with some of our populations who don't talk about sex very often, your questions might have to be very clear in terms of what exactly that you are asking. And I'll show you some of the examples of that in a moment. But very important is then to check how many sex partners we've had in recent months. Very important that we must be non-judgmental about those sex partners that they are having. And then my questions in brackets here are the sensitive questions that you're going to decide when it's appropriate to use them. So asking whether you think that your partner, the person's partner might be having sex with other people is a terrible question to ask somebody, actually. And we have to be very sensitive on how we phrase that and how we ask that. But also very important is to really screen for gender-based violence. And we don't do this often enough. So being able to ask, have you ever been hurt by your partner physically or emotionally, if you think it's appropriate. And then again, always asking permission as you go on. So if you're going to ask about the details of sex, then you want to be able to understand what kind of sex they're going to have. So do you have penetrative sex, genital? Ask about terminology they use if you're not sure. Anal sex, oral sex, there's tops, bottoms, or sides, all kinds of different ways of doing things. And again, it's a little bit about normalizing it. So it's very much how you phrase these questions. So when I ask about partners, I would ask, do you have sex with men or women or both? And I use it in a neutral way to create, show them that I am very comfortable with the fact that they might be having sex with men or women or both. So again, our sensitive questions that we do need to bring in, and with the chemsex, very important, especially with our young people and in our queer communities. Do you use alcohol or drugs when you have sex? And again, awkward question to ask, and you need to make sure you bring it within the right sort of safe space, but have you exchanged sex for things that you need? So having a little bit of an idea of transactional sex. And then when we talk about practices, and I was talking about hormones and sex earlier, remember I said pleasure is quite important. And how often do we ask people actually about pleasure and about sexual function? So quite often our focus is simply on STIs, but actually we need to say what's happening with your sexual desire, what's happening with your sexual satisfaction, what's happening with your sexual function. And there's something that if you are running a service with sexual health services, there's something called the Pleasure Project. You can Google it. It's a project from the Global Advisory Board on Sexual Health and Wellbeing, and they've actually got a pleasure meter, which is a way of asking about questions in terms of pleasure. And what I find really interesting about these questions is that you can see question 1 is about physiological and psychological satisfaction. But most of the questions is about self-determination, consent, safety, privacy, confidence, communication. It's these soft skills that creates the safety that makes pleasure possible. And then, of course, we want to ask how people protect themselves from HIV and STIs. So when we talk about condoms, just know when we talk about internal and external condoms rather than male and female condoms, that can all get very confusing. Ask about lubrication, ask about unprotected sex. And it's always good to open the conversation about PrEP, pre-exposure prophylaxis, and checking whether they've been covered for hepatitis B and HPV. Then we obviously want to take an STI history. I'm not going to spend time on that. That's the same for all of our patients. And then as we've spoken about, your 5th P there is your pregnancy planning. You need to really get an idea, what do they think is going to happen in the future? And of course, when you're chatting to an 18, 19-year-old, a lot of them think they're never going to have kids. But you got to ask them, well, what if you meet a partner that might want to have children? Now, what do you think about having children? What would you think about adopting children or using all these other different options of having a family if you may not be able to genetically have that family. So let's start looking at hormone therapy and get a little bit into the nuts and bolts of actually prescribing hormones. So this is actually a screenshot out of that HIV Clinician Society